Together we achieve victory over heart failure.
I am Dr. Mohit Jain, interventional cardiologist from Siddhanta Super Specialty Hospital, Bhopal. Today we are going to discuss about the essential insights on heart failure. As we all know that today our country we are delving into a silent epidemic that India is combating, that is heart failure. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It's a common occurrence into witness young adults seeking medical assistance for heart failure. Unlike the Western countries, where heart failure is predominantly a disease of the elderly. So let's break down 5 essential insights of heart failure. First of all, what does it mean when a doctor tells you that you have a heart failure? When people get a diagnosis of heart failure, they think it's the end of their lives. The term heart failure can seem frightening, but it simply means your heart is struggling to pump blood as efficiently as it should, or it is unable to take the blood from the rest of the body. That is known as heart failure with diastolic dysfunction. That is diastolic heart failure. But in our country, the prevalence, the most of the patients are with heart failure with reduced ejection fraction. Ejection fraction means how well your heart pumps blood. It is the amount of blood pumped out of your heart's lower chamber, that is ventricles, each time it contracts. You should know that a normal ejection fraction is almost 60%. It may vary from 50 to 70. Individuals with heart failure with reduced ejection fraction typically have an EF of 30% or lower. So, this is the basic definition of heart failure. Now comes to the second point. Why are so many Indians affected by heart failure? So, as we all know, the dietary habits in India is very poor. Obesity and smoking and tobacco habits, they all worsen this epidemic. And above all, genetics also play an important role because in some individuals there is no risk factors, but then also they had heart failure with reduced ejection fraction. They may end up into cardiomyopathy. So these all are the risk factors. Now coming to the third point, that is moving on. What are the signs and symptoms of heart failure? So it may vary from patient to patient. The most common symptoms are shortness of breath, associated with shortness of breath on lying down or awakening from the sleep due to shortness of breath. These all are terms which are categorized in shortness of breath. Other symptoms are palpitations, loss of appetite, vomiting, nausea, weakness. So you can say other constitutional symptoms. And now coming to the fourth point, how can we protect ourselves from this disease? Our heart work incredibly hard to keep us alive. There are 5 golden rules we can follow to return the favor. First of all, the first point is you should quit alcohol, tobacco, and smoking. The second point comes that is early detection of heart failure through regular blood test. Although blood test along with radiological tests are required, and sometimes intervention, coronary intervention to rule out the cause of heart failure is also required. The third point is dietary adjustment to maintain the heart failure. You should take a good sleep, good diet, healthy food, avoid oily, spicy foods, and the food that contains preservatives. The fourth point is incorporating daily exercise into your routine. If you are exercising well and if you have daily physical activity, there are least chances that you will end up into heart failure with reduced ejection fraction. And the fifth point is practicing stress management techniques. Lastly, coming to the fifth point, what comes next after a heart failure diagnosis? Thankfully, nowadays medical science offers numerous treatment options. It is possible to lead an enjoyable, meaningful, and productive life in spite of reduced ejection fraction. Heart failure medication improves quality of life and longevity. Earlier, if we talked before 20 years, there are only few medicines that work on heart failure, that also partially. But nowadays, we have multiple, numerous number of medications that control the heart failure exponentially. These are ARNI, ACE inhibitor, beta blocker, and spironolactone antagonist. ARNI, all of you know that many brands are already in the market. Among them, one is Valentus, other is Vimada. These all are popular brands. If we talk about devices, then there are biventricular pacemaker, implantable cardioverter defibrillator, that is known as ICD, and CRT also, that is cardiac resynchronization therapy. And above all, heart valve repair, or nowadays heart transplantation is also a popular surgery that people are undergoing. And the last resort treatment option is heart transplant. That was I told you earlier. These all are 5 points you have to keep in your mind to protect yourself from landing into heart failure and protecting your friends, colleagues, relatives, and your loved ones, those who have already landed into heart failure, to protect them by the means of such medications and devices. Thank you.